Health Minister Moses Uwp'S claims that there is no credible evidence to validate claims that the previous UWP-led government had plans to appropriate funds to cover a national health insurance program for citizens. The previous administration, now the opposition United Workers' Party, has criticized the current Philip J. Pierre-helmed SLP administration's public healthcare policies, including universal health coverage. Uwp'S claims that nothing was set in stone where the previous UWP's health policy is concerned.
I have heard a lot about the National Health Insurance Program. I heard the last government indicated that they had a program to give X amount of money to St. Lucians for national health insurance. I want to say to you that there is no credible evidence that I have before me as Minister for Health to substantiate this. And if anything was being worked on, there is no evidence that there were any conclusions for the implementation of a national health insurance program.
Minister Uwp'S revealed that the present SLP government is currently working with an international funding organization to implement a sustainable health financing model.
We are working with the World Bank, and we are also working with a consulting group called JIPA. We have said so before in the public, and we are going to come up with a health financing model which brings together both the public sector and the private sector. We have been in consultation with the Tapion Hospital. We've been in consultation with the St. Jude Hospital, the Millennium Heights Medical Complex, insurance companies in St. Lucia, the National Insurance Scheme, to come up with a model which is sustainable, which we will be able to finance, which we will be able to fund, and which will be to the benefit of the people of St. Lucia.
The health minister alleges that the opposition had ample time to start a national health insurance program during its tenure in office, but did not, arguing that the current Pierre government is rolling out its universal healthcare program in a phased approach.
The difference between what the last government calls their national insurance plan and what we are doing, which is the implementation of the Universal Health Coverage Program, the difference is the last government wanted to do something. Now they are saying they could have done it. They should have done it. They spent over 5 years in government and not one additional service in the Universal Health Coverage, under the umbrella of Universal Health Coverage, not one additional service was provided to the people of St. Lucia. You compare that to our system, or you compare that to our strategy towards the attainment of universal health coverage. We came into government and we decided that we were not going to wait for the complete financing model or for the complete financing policy before we provide services to the people of St. Lucia under universal health coverage.
Minister Uwp'S further explained that the government selected a basket of essential UHC services while it works on completing its sustainable financing model. The UHC program kicked off with maternal services, providing ultrasounds and tests to expectant mothers. The government then proceeded to add cervical cancer and prostate screening services, given the high number of cancer deaths recorded in the country annually. These initiatives, officials claim, are being offered to the public free of charge. Gina Filippi, HTS News Force.